Hi, everyone. Welcome to the Centers for Disease Control and Prevention's National Healthcare Safety Network training for long-term care facilities. Today's training will focus on enrollment. Just a few housekeeping rules. Please use the Q&A box to type in your questions throughout the presentation. We will do our best to answer those questions as they come in. This presentation is being recorded, and the slides and the recording will be available on our long-term care facility COVID-19 website, possibly next week, after we go through captioning. In the meantime, we do have enrollment slides on our website, as well as a great enrollment guidance document that you can use. So today's training is really a high-level overview of the enrollment process, and we're hoping to capture some of the common questions that we are receiving from our users. So let's get started. Okay. So as you've previously learned, or if you're new, there are really 4 primary steps that I'm going to be talking about today in order for you to gain access to the COVID-19 module for long-term care facilities. So the first step is preparing your computer, and this is a really important step. And Ty McCrae discussed this in detail in her enrollment training, which her slides are available on our website. So I did not include those details in this particular presentation, but it's very important that you do look at the section of the guidance document or previous enrollment training slides so that you know how to set up your computer to receive emails from NHSN at cdc.gov, as well as SAM's no reply at cdc.gov. So this means you may have to change your spam blockers, you may have to add CDC to one of your trusted sites and allow pop-ups from the CDC. It also means that you need to make sure that you're using the correct internet browser and that your internet browser is up to date. So all of that information is available in the earlier enrollment training. I also have a website, or excuse me, a website at the bottom of that slide that you can click into, and that takes you to the enrollment training slides where you can get additional details. So that's the very first thing that you want to do. And if you're lucky enough to have technical people in your facility, it would be to your benefit to get one of those persons to come and help you check your computer and make sure everything's set up. The next thing that you have to do, and this is really the first step to getting started with the entire process, is you have to accept the NHSN rules of behavior. I have the link right here for you, so you could click right into this link. It's also provided on our website, and that is how you get started. So you're going to register your facility with NHSN. Very easy process. The next step is you're going to register with SAMS, and this is really our security checkpoint, okay? And this is more about you than it is the facility. And I'm going to go into details with each of these steps, but then after you register your facility, you're going to enroll your long-term care facility with NHSN, okay? And there's some steps here on how to do that. Part of enrollment is electronically accepting the agreement to participate and consent. So I'm going to go through each of these steps, but this is a high level of what you will do to go through the enrollment process. Okay, so the first part here is you're going to register your facility with NHSN. And like I just said, you're going to agree to the rules of behavior. And there's the link for you. You can click into that link, or if that doesn't work, you can copy and paste the link right into your browser, and that will take you to the rules of behavior. Once you accept the rules of behavior, you're going to have a registration page appear, and there's a little screenshot here of what it looks like. And this is where you're going to enter some of your personal information. So your name, and most importantly here is your email address. The email address that you use to register your facility must remain the same through the entire registration and enrollment process. If it does not, or if you accidentally hit the wrong key, then you're going to have a problem with enrollment. So just be sure to double check that email once you type it into the box. The next thing you're going to do is enter a facility identifier. Now, a facility identifier is a CMS certification number if you are a CMS facility, or it could be the CDC registration ID if you are not a CMS facility. So for example, if you are a CMS certified nursing home or skilled nursing facility, then you will have a CMS certification number, also called a CCN number. And that number should be entered into this box. So it's really hard to see on the screen, I think, but if you can see in the box, there is a, I think the very first radio button says CMS ID. You'll click into that radio button, and then in the box at the bottom is where you enter your number. If you are not a CMS certified facility, then you will request a CDC registration ID, also known as a temporary ID, from the NHSN help desk. Hopefully many of you or most of you have already received this temporary ID number, because we've held 2 sessions this week to give out those numbers. So I'm really hoping that most of you have the number. So once you enter your facility identifiers, the last thing you're going to do is certify that you have completed training. We know that this has been a rushed process. Many of you have completed training in various formats by going to our website, looking at our slides. So what you can do, if you haven't formally completed training or listened to a webinar, just enter the date that you are registering. Make it simple, because we know at some point you are going to complete training. So that you can get past this step, if you don't have a previous training date, it is okay to enter the date that you're registering, okay? Okay, so next, I wanted to give you the link. If for some reason you don't know your CCN number, there is a link that you can go into to look up your facility, and it should provide you with your CCN number as well as your participation date, and NHSN calls that the CCN effective date. So if you look that number up during this process, go ahead and not only write down the CMS certification number, but write down that effective date as well, or that participation date, because you will need that in a later process of enrollment. So go ahead and write both of those down and have that as you for the enrollment piece of the process. But here's the link. You will select tools, do a basic search, enter your facility name, and hopefully you will be able to find your facility, and then you can enter your number. Now, if for some reason you are not able to access your CCN number, you can't find it in this list, you're a new facility, whatever reason, it is okay to request a temporary ID number from NHSN, so a temporary CDC registration ID from NHSN to get you through enrollment, okay? So but the preference is that you try to find that CCN number, because if you are a CMS certified facility, you do have to have the correct CCN number in NHSN in order for your data to be submitted to CMS to meet the mandates, okay? But if you don't have it during this process, go ahead and get that temporary enrollment number and get through the process. And when you're all enrolled, we can show you how to go back in and enter your CCN. We actually have a guidance document on our webpage that gives you steps. It's very easy to do. So this is all you need to know about the CCN. So next, once you finish this registration, you're going to move to the next part. You're going to receive an email from SAMS No Reply, and this is why it's really important in the very beginning to make sure that you have your computer settings correct, because some facilities will block emails that are unknown. So we've had facilities in the past block any emails from NHSN, any emails from SAMS. So that's why it's very important to add these emails in the very beginning and make sure that your computer is set up. Normally, users would receive their SAMS No Reply email within 24 hours. However, NHSN is in the middle of enrolling 15,000 facilities, and it is taking us a little bit longer than normal. You should expect to receive your email from SAMS within 5 business days of completing your registration. We do ask, because of the influx of emails that are coming in, that you please give us 5 days, business days, to get you your SAMS no reply email before sending us an email to the inbox. The reason is that these emails that are continuously coming in are slowing down the process because we're having to split staff time between answering emails and handling enrollment. So we do ask that you please be patient with us. We understand that this is a critical time period, and we understand everybody is stressed and under deadlines, and we are trying our best to get this turnaround time as quickly as possible for you, but we just ask for a little bit of grace and patience from you. Okay, so this is an example of what your email will look like. It comes from SAMS No Reply. I believe you also receive an email from NHSN as well, but the SAMS No Reply email is the most important email, because if you scroll down to the very bottom down here where you can see I have squared in, there is going to be a hyperlink that you're going to click into. But even before that, you're going to see here, you're going to have your username, your SAMS username, which will be the email that you entered when you registered. And it's also going to provide you with a temporary password where you can just copy that and paste it. If the hyperlink does not work for you, when you click on that hyperlink, copy the hyperlink and paste it into your internet browser. So once you do that, you're going to come to the SAMS credentialing screen. It'll look similar to this, but you may see other things on the page as well. But this is what you're looking for. You're looking for the SAMS credentials with a little keyboard. Your SAMS username that you're going to enter is the username in your email, which should be your email address that you use to register. Remember, it's very important that you're using the same email address. So you'll enter that SAMS username, your email, and then enter the temporary password. Once you do that, click Login. Once you log in, it's going to take you to a screen similar to this. And with this screen, you're going to read and accept the SAMS rule of behavior. So just so you know, NHSN and SAMS are 2 separate entities. NHSN is us. We have the NHSN platform, we have the COVID-19 module. SAMS is more like the security checkpoint. They're a different team of people, and they are making sure that you are who you say you are, and they are responsible for your passwords and your security questions. So think of it as you're going through the security checkpoint, and that is SAMS, okay? So that's their responsibility. So you have to read their rules of behavior as well, and then once you click accept, you're going to come to the next screen, and they're going to ask you some registration questions. And the registration questions are going to be about you mostly, because remember, it's your checkpoint because you're the person who's trying to get access to secure information. So you will enter your personal information. It will ask you some information about your facility, but most importantly, this is where you're going to create your password. It will have you change your password to your very own password. Very important that you write that down, because if you have a memory like mine, or if you're really busy, it's so easy to forget passwords. And these days we have to have all these crazy passwords with all these symbols and everything else. So I highly encourage you to write down your password, or if you have a smartphone, what I do is I take a picture of my password and my answers to my security questions, and I put it in an important folder in my photos in my phone. And so if that is something that you can do, I encourage you to do that. That is probably one of the most common reasons we receive emails from users is they forgot their password. So what SAMS has you do is you set up your password, but you also answer, I think, 4 security questions. And that way, if you forget your password and you have to call SAMS, they can ask you the security questions, and as long as you remember the answers, they will reset your password. So very important, write down the password as well as your responses to your security questions, or take a picture and make a folder in your phone that says important documents and save it there. Okay, so once you complete this part, you are waiting again for another email. Again, this email very well could take 3 to 5 business days. And this email is going to come again from SAMS No Reply, but it's going to be a welcome to the National Healthcare Safety Network email. Basically, this is your ticket that says SAMS has allowed you through the checkpoint. You're now through the security gate, and you can register your facility with, or excuse me, enroll your facility with NHSN. But you do need to wait on this email. Again, give us 3 to 5 business days, please, before you send an email. Once you receive this email, then it looks similar to this screenshot you can see here. You can log into your SAMS portal, which is the sams.cdc.gov portal, and I believe that's in this email as well. And once you log in, you're going to come back to this SAMS credentialing page. Okay, so here's the login up here for you. Here, you're going to enter your SAMS username, which remember is your email address, and then the password that you selected during your SAMS registration. Then you're going to click login, and you're going to come to this page. Now, this is where you begin enrolling your facility with NHSN. If you look kind of toward the middle, top of the page, you'll see an area that says My Applications. Under that, you're going to see NHSN Reporting and NHSN Enrollment. So you can't start reporting until you enroll, right? So you need to select NHSN Enrollment. When you do that, you're going to get a page that looks similar to this. At the top, it says access and print required enrollment forms. That is not necessary. You're free to look at those forms if you want. And basically what those are is it's just the forms with the questions that you're going to be asked when you enroll a facility. But I'm about to tell you a lot of what that is, so you don't really need to do that. You can go directly to enroll a facility by clicking that link. And then you're going to get something similar to what I have in the blue part here. It's going to say facility enrollment. The first part is going to ask you your facility information. So your facility name, address, so forth. Be sure that you spell your facility name correctly. And you're going to then come to the next section, which is going to be facility identifier. Okay, so remember we did the facility identifier in the very beginning when you registered your facility, right? So that is your CMS facility certification number, or CMS certification number. And this time you have to enter that effective date, also known as the participation date. So that's why I was telling you at the very beginning, if you have to, when you're retrieving that information, go ahead and get that participation date as well, because you'll need it to enroll. Again, for non-CMS facilities, you will need that temporary enrollment ID. So let's look at this next page, because I have some screenshots here that I think will be helpful if you can read this. I recognize it's a little bit blurry. Sometimes the screenshots don't come up as great as I would like, but at the top up here, so this is for facilities that are CMS certified. You can see I clicked select NA for non-applicable for everything except CMS certification number. Okay, and then I enter my CMS certification number, and then I enter my effective date of my CMS certification number, otherwise known as participation date. Now, if for some reason you do not know your participation date or your effective date, that's okay. Go ahead and enter the date that you are enrolling your facility. The reason that the effective date is so important is because facilities that have reporting mandates, so for example, hospitals, the effective date is important because if your CCN number changes, then maybe the reporting mandates change, but we have to keep that updated so that we know what data has to be submitted to CMS. So it's really important that as you move on with COVID-19 reporting, that you keep that effective date and the correct CCN updated. But for your first time, since you guys are brand new to mandates for CMS, If you don't know the effective date, go ahead and enter the date that you enrolled your facility. Now, if your facility changes ownership and you get a new CCN, you will need to add the new CCN, and you will at that time need to enter the new effective date. That's very important, okay? Now, if you are a non-CMS facility, so if you are assisted living facility, residential care, any other type of facility that is not a CMS facility, what you're going to do is, this is really important, you're going to select NA for every single box. NA for AHAID, NA for the CMS Certification Number, NA for the VA station code, and after you select, only after you select all of those NAs, will an additional box appear, and that box is the enrollment number box, and that is where you will enter that temporary enrollment number that you received earlier from NHSN. You can use the same temporary enrollment number that you received to register your facility. The enrollment number is good for 30 days. So as long as you complete all of this within 30 days, you can use that same number. So if you have a temporary enrollment number in your hand right now, that is gold, because we know that it's taking several days to get responses from the help desk. So make sure you hold on to that temporary enrollment number so you can use it again. Enter it here. And then at the very bottom, there is a button and it says Verify Data. You will click that button, and what that does is it verifies the numbers that you've entered are correct. If for some reason it comes back and it will not verify, then you have a little bit of a problem. If it will not verify with your CCN number, what that means, it doesn't mean that your CCN number is incorrect necessarily, but do check it to make sure it's correct. But it could mean that your CCN number is not in the NHSN database yet for some reason. So CMS sends NHSN a list of CCN numbers as they're updated. And so if yours doesn't validate, it could simply mean that your number hasn't been updated into the system. If your CMS number does not validate, at that point, you will need to follow the instructions for a non-CMS facility to get through enrollment. So that means you'll have to select NA for everything, and then get a temporary enrollment number to enter here. That is the only way that you will be able to get through enrollment. If you do that, it's okay for enrollment, but once you get your facility enrolled and you're reporting, you must remember to go back in and update that or add your CCN number and effective date. I cannot stress that enough. If your CCN number and effective date is not correct inside the NHSN application, your data will not be submitted to CMS. So it is very important that you go back in and you check that and you enter that. And I will show you how to do that. Actually, I think I have a link somewhere on these slides, but on our webpage, on our COVID-19 webpage for long-term care facilities, we do have a guidance document under facility resources that shows you step-by-step how to update your CCN or add your CCN number. Okay. Next thing that you're going to do is you're going to select your NHSN facility type. In the enrollment part, you will notice that there is no selection for COVID-19 like there is in the registration part. All you have is just the regular selections for NHSN. That is okay. Select your facility type, so you're going to either be a skilled nursing, and that includes your skilled nursing facilities and your nursing homes. Those two are considered skilled nursing facilities, or you'll be a assisted living facility, and that can include your residential, or you'll be a facility for developmentally disabled. Okay, so be sure to select that correct facility type, just remembering that COVID-19 will not be in those names, and that is okay. At this point, every NHSN enrollment that is coming in for long-term care facilities, we are treating them as COVID-19 module only unless we're told otherwise. So then you're going to also down here under components, you'll select long-term care facility. When you come to the page to enter your NHSN facility administrator, that is likely going to be you because you are the person enrolling this facility. So be sure that you enter your name exactly how you entered it during the registration. All of this needs to match up because remember that security checkpoint is looking to make sure that you are who you say you are. So that means registration with NHSN, registration with SAMS, and enrollment. All that information has to match, and that includes your facility name and address. It all has to match. So you enter your name up here. If you look kind of on the left-hand side where I have the red arrow button pointing up, that is a copy button. So if you click that, it will auto-populate all of your facility information for you, and that just keeps you from accidentally making mistakes. So I highly recommend that you just click that and let it auto-populate. Now, as we get down toward the bottom, I want to point out a couple of things. So you see down here, it says email. Make sure that you use the same email address that you entered during the SAMS registration. So that is also your SAMS user ID, okay? And then below that, this gets people confused. So please pay special attention to this part. You see where it says user ID? That does not mean your SAMS user ID. This is a user ID specifically for NHSN. How do you want to be identified in the NHSN application? Because your user ID will, every time you log in to NHSN, is going to show your user ID. And it cannot have any special characters, so you can't use your email address for your user ID. I recommend something that you're going to remember. Like, for example, my user ID is just my first initial and my last name, no special characters, no periods or anything. It's just A Antilla. So just put a user ID that, it could be your dog's name. It could be whatever you want, but it can't be more than 32 letters or numbers and no special characters. Then you're going to be asked to enter the long-term care facility contact person. The contact person could be you, and that is okay. If it is you, you see this little icon to the left, you can click that again and it will populate your information that you've already entered. The same thing below. It will populate your mailing address, everything. Here. So I recommend using that just to maintain accuracy. If you do end up adding an additional contact person, which we do always recommend having a backup person, what that means is that that person will have the ability to be your backup person, but also receive communications from NHSN and so forth. However, even if you add that person as a contact during enrollment and you want the person to have access to NHSN, once you complete enrollment, I believe you still have to add that person as a user in your facility. Once you do all of this, you're going to click the Submit button. And you should receive a pop-up that looks similar to this that says, congratulations, your facility has been enrolled. But if you notice under it, there's a however. We don't like howevers, right? However, your facility is not yet activated. And the reason is that the very last thing that you have to do is you have to give a consent. So from this page, if you're going to enroll another facility at the bottom, you can click here and you can start enrolling another facility, or you click exit. Once you do that, then you log back into your sams.cdc.gov, enter your credentials. From the drop-down, you should see long-term care facility component, and then you should see your facility under select facility. So you select the facility, click submit, and the bottom rectangle down here is what you're going to see, or it may come up as an alert on your page. But basically what you have to do is you have to find your name, and this will happen for the NHSN facility administrator as well as the facility contact, but only one of you has to accept the consent, I believe. So what you're going to do is find your name, and you're going to click accept. See the right hand corner where I have the blue arrow? Make sure you put a checkbox there. If you are the facility administrator for multiple facilities, all of your facilities will show up on this page. And the good thing is you can just go down and check, so that you don't have to log in individually to each one of them. So you check all of the facilities that are listed by your name. You'll receive this alert pop up that says you have completed the NHSN agreement to participate in consent form for the long-term care facility. That number is your facility org ID, your facility number. You click OK, and after that, you are done with enrollment. So beyond that, you are ready to start reporting. So you can then go back to your SAMS page, log in. When you log in, you're going to come to what we call the NHSN Long-Term Care Facility Component homepage, which looks similar to this. If you have level 1 access, meaning that you have access just to the COVID-19 module, you're going to see what's on the left side, and you can see the yellow square rectangle around COVID-19. You would click into that box, and that's going to open that module for you. If you are SAMS credentialed and you have full NHSN access, you're going to see what's on the right, and that just shows you other reporting options. And this is for people who have been enrolled in NHSN and have been submitting HAI data or your C. difficile data, so you have access to all of your analysis and so forth. So the screens look a little different, but the COVID module is exactly the same for regardless of your enrollment type. So you're ready to begin reporting. So now I just want to go through a couple of common questions that we receive. If you have an active SAMS grid card and you need to enroll a facility, so you already have your grid card, you're ready to roll, right? So what you would need to do is you click into a different part of, so non-grid card, you're going to click into this first one you see with the keyboard. But if you have a SAMS grid card, you're going to click into the one that shows the card because you enter your grid numbers, okay? So you log in, and then you follow the steps that I just went through, starting at enrolling a facility. So go to under My Applications, enroll a facility, and then go through those steps. And that's what you would do for each of your facilities. If you did not follow my advice and write down that password or take a picture, then you will need to contact SAMS. I recommend just giving them a phone call. They usually answer, unless they're super busy, they usually answer right away, and let them know that you forgot your password. And what they will do is they will ask you your security questions. So hopefully you remember the answers to your security questions, okay? I do want to point out, if you have an active SAMS grid card and you are enrolling with your grid card, so let's say that you are the NHSN facility administrator for acute care facility that reports into NHSN, and you want to add your skilled nursing facility or nursing home, and so this is how you would do it. You will have to complete that annual facility survey because you are gaining access to the full NHSN capabilities, okay? So you will have to go through the full enrollment for the long-term care facility component, which is not much different than what I just showed you. The only difference is you have to complete the long-term care facility annual survey. And that annual survey is based on, most of the questions in that survey are based on the characteristics and practices of that facility in the previous calendar year. So for 2020, you will be answering the survey based on the characteristics of your long-term care facility in 2019. If you have any questions about that, we are happy to help you with it. We also have guidance documents for you. Something else, let me just look at my notes really quick. I had some other notes I wanted to mention that I was told at the last minute Okay, so I just said if you have a Sam's Grid card, you can log in at the facility level, enroll a level 3 facility. Okay, this is what I wanted to tell you. So if you have a Sam's Grid card, you can only enroll a level 3 facility. What that means is when you enroll a facility, that facility will have to go through the full process if you're assigning a new FAC admin or a new contact. However, a way to get around that, if you just wanted to enroll the facility into the COVID-19, you would have to create a new SAMS email address. And I would highly recommend, I am not the expert at how to do that. I would highly recommend that you submit a support ticket and get expert help from our NHSN support team because they are the enrollment experts. Okay, let's see what we have next here. So this is a common question we are receiving right now. I selected the wrong facility type during enrollment. That's okay. Finish your enrollment, and once you fully get enrolled, it's very easy to log in. So you can log into NHSN, and it's very easy to update your facility type. So you log in, and actually let me go back. I'm going to go back to the back screen just to kind of show you where you're going to go in. Okay, so you would log in, and then so we call this the navigation bar. See the gray area here? I don't know that you can see my mouse moving, but the gray area here, you have COVID-19, users, facility. You click facility, and when you click that, it's going to open some options for you, and that is where you would select facility information. And when you select facility information, all of the information that you entered during enrollment will show up, and that's where you can make your changes. That's also where you would go to change your CCN number. So it allows you the ability to change your facility type or anything else that you needed to change. Just remember to click save at the bottom of the screen and it will update for you. For those of you who are in the backlog list and you're still waiting to get enrolled, you have to still collect the data, right? So what I would recommend is that you use the NHSN data collection forms that we have available. We have forms for each of the pathways in the module, and they are available on our website, and I have that posted here. And you would use one form for each date in which you're going to enter data. And I also recommend that you use the form instructions because how you interpret the question may be different than what the question is really asking. So it's very important that you not only look at the forms, but you look at the form instructions. So even if you're not going to use our forms, I still highly encourage you to read the instructions because the instructions go line by line. So every question in each pathway has an instruction associated with it to tell you what kind of data to enter, how to enter the data, the definition. So please use those until you become accustomed to the definition so that you're entering correct data. And correct data entry is important so that we can get resources to you if need be, and so that you're able to look at, patterns within your facility, and you're able to look at improvements or areas where some different strategies may need to be taken. Okay, let's go to the next slide. We're almost done here. How do I receive LTCF COVID-19 updates if I'm not enrolled in NHSN? So if you haven't been enrolled yet and we don't know who you are and we don't have your email address, if you go to our webpage and you scroll to the bottom, you'll see this little box that allows you to put in your email. By doing that, any updates that we send to our users, you will also receive those updates. So any updates we make in the application, any newsletters, any trainings that are coming up, you will be included if you put your email there. Now, if you're already enrolled and we have your email, you don't have to do this because this is just for people who are not enrolled, or maybe you want to also receive emails at your personal email account. Then you could do that here. Okay. Here are some resources that may be useful to you. They're all hyperlinked. And this concludes our presentation.